Hello everyone. In this session, we'll be talking about one of the bacterial diseases of human beings, and that is typhoid. Typhoid is a bacterial infection caused by a pathogen called Salmonella typhi. And the common characters of this disease is high fever, diarrhea, vomiting. Sometimes, if it is not taken care of, the symptoms, the disease can be fatal. Otherwise, it is not all that complicated to be treated. And talking of the transmission, this virus can be passed on through contaminated food and drinking water, through the fecal oral route, which is a common mode of transmission in less industrialized countries or the developing countries or the underdeveloped countries. So, it is also frequently seen in the regions where hand wash is a less frequent habit, and it is a serious health threat in the developing world, especially for the children. Most people with typhoid fever, when they begin with the treatment, they start to feel better. But however, only a very small fraction, as I told you earlier, in a few cases that have not been properly taken care of, typhoid can be complex and eventually be fatal. And there are vaccines available for typhoid, but they're only partially effective. And such vaccines are usually reserved for those people who will be traveling frequently to those countries or regions where typhoid fever is a common disease. So, now talking about the symptoms of typhoid fever. The symptoms of this disease are likely to develop gradually. So, they will usually take about 1 to 3 weeks of time after being exposed to the bacteria for the symptoms to occur. And the early symptoms include fever, headache, weakness and fatigue, muscle ache, sweating, dry cough, loss of appetite, abdominal pain, diarrhea or constipation, rashes, along with swollen abdomen. And if this disease is not treated when these early illness symptoms occur, the disease may be advanced to the later illness phase where there is deliriousness happening, lack of motion or movement, and exhaustiveness. All of this, the advanced symptoms mostly occur due to excessive dehydration that is observed. Trying to understand the causes and transmission of salmonella typhi, or the typhoid disease, it is caused by a virulent bacteria, salmonella typhi. We have spoken about this already. And the transmission mostly takes place by fecal oral transmission route, where the pathogen is spread through contaminated food or water, or sometimes through direct contact. I mean, if a person with typhoid comes in direct contact with a non deceased person, maybe he could transfer the pathogen directly. Otherwise, the most cases of transmission are through contaminated food or water. Having said that, the typhoid fever is endemic to the developing nations. So, what is meant by an endemic? Endemic is a kind of disease that is mostly seen in a particular region of the world. And typhoid is endemic to developing nations. So it is mostly seen in the developing nation regions of the world. And this is because most of the cases are transmitted easily due to consumption of contaminated drinking water along with the poor sanitation measures that are taken in these developing countries. And talking about the developed or industrialized countries, typhoid can occur only when people traveling from such countries go to a country where typhoid is an endemic, and they might carry it back to their country and spread it to others through the fecal oral route. This means that the Salmonella typhi is passed on through the fecus or sometimes via urine of the infected people. Next, there is another way of transmission of the Salmonella typhi, and this is called the typhoid carrier transmission. So, what happens is a very few people, even after the treatment for the typhoid fever, may still contain small amounts of the bacteria in their intestine or the gallbladder. And such people are called the chronic carriers, and they can shed the bacteria in their feces for a longer period of time. They will not show the symptoms, they will not show any disease occurring in them, but they will be capable of transmitting the disease to others. And such people are called the chronic carriers or the typhoid carriers. And along with this, the risk factors associated with the transmission of typhoid are firstly, like first of all, typhoid fever is a serious worldwide threat, particularly in the developing world, and it affects as many as 26 million or more people every year. It is endemic to the developing nations such as India or the regions of the Southeast Asia, Africa, South America. And globally, children are at a greater risk of the disease, but however, they show milder symptoms as compared to the adults. And such risk is increased if the person works in or travels to area where typhoid fever is established as an endemic, or if the person is working as a clinical microbiologist who frequently handles the Salmonella typhi bacteria, then he is in a possibility of being infected. Or if a person is nursing or having a close contact with somebody who is already infected, then this person also might carry the infection. And finally, drinking of contaminated water by Salmonella typhi. So now trying to understand the complications associated with typhoid. One of the major complications of typhoid is intestinal bleeding or holes. And as a matter of fact, this is the most serious complication of the disease, and this occurs in the later stages, that is, only after the third week of the exposure to this pathogen. And here, the intestine gets perforated, meaning that there are small holes or a single hole that is developed either in the small intestine or the large intestine or the bowel, meaning stomach. And this results in leakage of the intestinal contents into the abdominal cavity, leading to severe abdominal pain, nausea, vomiting, and also sepsis. And when this happens, the person infected and suffering from intestinal hole is at a greater risk of death due to typhoid. And this will mean that the person needs an immediate medical attention. There are other complications also associated with typhoid. They're less common and they could be myocarditis, endocarditis, pneumonia, pancreatitis, infections of the kidney or urinary bladder, meningitis, and also psychiatric problems such as delirium, hallucinations, and paranoid psychosis. So, now moving on to the prevention of typhoid. In any country, be it a developed country or a developing country, the public health goals must be to provide safe drinking water, improved sanitization, and adequate medical care. But such facilities have been difficult to achieve in many of the developing nations. So, in situations like this, vaccinating the high risk populations is considered to be the best way to control typhoid. Also, additionally, if a person comes from a region where there is availability of safe drinking water, improved sanitization, and adequate medical care, that person, if traveling to a country with high risk population, is always recommended to be vaccinated. And there are two such vaccines for typhoid. The first variety is known as the Y capsular polysaccharide vaccine or the VIPS, which is a subunit vaccine that is injected as a single dose to the person who is planning to travel. And this is usually done at least 1 week before traveling. And the second variety is the typhoid conjugate vaccine or the TCV, which is in here which is also known as the TY21A, which is a live vaccine that is given orally in 4 capsules, where one capsule is taken on a daily basis. Although vaccination is the best prevention measure that we have, they are only 30 to 70% effective and they require repeat immunizations because the effectiveness of the vaccination diminishes with time. And apart from this, healthy prevention practices include frequent hand washing using hot soapy water before eating or preparing food and also after using toilet. In an event where there is no water available, alcohol based hand sanitizers may be used. Also, additionally, you know, uh, people should take care to avoid drinking untreated water, eating raw fruits and vegetables, and also to consume more of hot or freshly cooked and hygienic foods. So, this is a very common protocol that is followed. Sorry, common protocol that is followed to prevent typhoid. Now, moving on to the pathogen morphology of Salmonella typhi. It is a rod shaped bacteria that is of about 1 to 3 into zero point 0.5 to zero point 0.6 micrometers in length and width, and they are usually arranged singly or in pairs. These bacteria are motile in nature, so meaning that they can move, and this motility is usually prompted by a flagella, that is, of peritrichous flagella arrangement. However, these bacteria do not produce any spores and they do not have any capsules, thereby indicating that they are gram negative staining bacteria. And the culture characteristics of the bacteria differ slightly with the medium that is being used for culturing. The most commonly used media are the nutrient agar medium or the NAM, Wilson and Blair bismuth sulfite medium, McConkey agar medium, blood agar medium, xylose lysine deoxycholate agar XLD medium. And upon culturing, the shape of the bacteria will remain circular in all of this media, and the size is also commonly like 2 to 3 millimeters. Talking about the elevation of the cultures, like this bacterial elevation is convex only in the Wilson Blair bismuth sulfite medium and the XLD medium, whereas in the NAM, McConkey, and blood agar, the elevation is of low convex, and the surface appears to be smooth in all the cases except for the Wilson and Blair bismuth sulfite medium, where the surface is both smooth as well as glistening. The color of the culture differs with the medium used. For NAM, the culture color is grayish white, whereas the culture color is jet black with the metallic sheen in the case of Wilson and Blair bismuth sulfide, and colorless in the case of McConkey agar. In the blood agar medium, the culture collection is again grayish white, similar to that of the NAM, whereas in the XLD, the cultures appear to be red with a black center, and the structures are translucent in the case of NAM and blood agar medium, whereas they may be translucent or opaque in XLD. Meanwhile, the Wilson Blair bismuth sulfide medium cultures appear to be opaque, and McConkey agar medium cultures appear to be transparent. And as far as the hemolysis is concerned, this can be identified only in the case of blood agar medium, and the hemolysis is gamma hemolysis occurring, meaning that these bacteria are non hemolytic in nature. So they do not break down the blood cells or red blood cells. Now, talking about the diagnosis of typhoid, initial diagnosis will include study of symptoms, medical, and travel history, and after which the diagnosis is usually confirmed by culture tests of either blood or other body fluids or tissues. The tissues that are commonly used, tissue or body fluid commonly used for Salmonella typhi culture is blood, stool, urine, or bone marrow. And upon culturing, they are visualized under a microscope to check for the presence of the typhoid bacteria, that is Salmonella typhi. And the best used samples for such a diagnosis are the bone marrow cultures because they are the most sensitive for Salmonella typhi culturing. Now, moving on to the treatment of typhoid. Typhoid is mostly cured with the antibiotic therapy, and the commonly prescribed antibiotics include ciprofloxacin, azithromycin, and ceftriaxone. But however, like in the past, there have been numerous instances where the typhoid bacteria can get resistant to antibiotics. Like, for example, chloramphenicol, which was a drug of choice in the past, and now it is no longer used because of firstly the widespread bacterial resistance, along with the side effects and high rate of health deterioration after a period of improvement, meaning that there is a possibility of relapse of typhoid after a duration of time. So now this existence of the antibiotic resistant bacterial strains has been a growing problem in the treatment of typhoid, and so far there are already so many resistant strains which are resistant to antibiotics such as trimethoprim, sulfamethoxazole, ampicillin, and ciprofloxacin. So the best treatments also include increased intake of fluids, which helps prevent the dehydration due to prolonged fever and diarrhea. This will also control the intestinal perforation. So, if a patient is severely dehydrated due to typhoid, the fluids may have to be administered intravenously as well. And next is surgery, which has to be conducted in a case of perforated intestines. So, with this, I would like to conclude today's lecture. If you have any doubts, you can always write a mail. Thank you all. Thank you so much.